right, so the first thing I want you to see there is that awesome graphic. We have a very diverse team. We tried to think about everything that we could possibly need to make sure that the mobility management trainee is going to be ready to do the work that has to be done. So we had to consider all that. But another important aspect is the look of the Canvas site, because you do want to have the look and feel. We'll talk on that a little bit more, but I just wanted to send out that shout out there. All right, so in 2019, MRHA received a grant to develop a mobility management curriculum. This grant was from ICAM, Innovative Coordinated Access and Mobility, through the FTA. I did not know FTA. I mean, I've heard of the Federal Transportation Administration, so I just add that part in case somebody else in here is not aware of all of the transportation lingo. The group did start meeting in January of 2019, but I had not even started working my current position. And so they met in January and February of 2020. And as you know, that is when all of the COVID started really becoming concerning here in the United States. So I was brought on board with the Office of Hope in March of 2020. I started on a Monday, and on Wednesday, that was when we were all sent home to work from home. We started talking about it internally, and I wanted to make this on April 22nd of 2020 is the first time I had ever heard the word or the phrase mobility management. I knew what mobility was. I knew what management was. Mobility management, however, I had no clue. But then the next part of the conversation was about curriculum development, and that is, I am a consummate nerd, and so that is something that I just love. And so I said, I can do it. So we figured out a budget, figured out how it would work internally, and then went to MRHA. And then by August 11th, we were meeting. Well, yeah, that was the first meeting with the entire team. Or as they were to me on Teams, just these big dots with initials. And yes, so it was very intimidating and quiet that first meeting. But right after that, we got started with regular biweekly 2-hour meetings. This team for 2 hours every 2 weeks, and we hashed it out. And then, because it was a process, we had to get to know each other, and we had to be able to listen to each other's ideas. And they had to teach me the language of transportation and mobility. And that really is the biggest hindrance whenever you're taking on a project like this, is learning how to speak the language. Wrong one. I'm not going to spend a lot of time on the presentation objectives because Sandy read them for me. Thank you so much. But I do want to point out that when we talk about transportation needs in rural areas, a lot of times what we're talking about are people who are of a lower have a lower socioeconomic status. And I think we have to begin to understand that it's not about getting people who are taking advantage of the system to where they want to go. This is a necessary thing for the community. The community is not going to be able to address the needs of these unseen people because they're not able to get out and interact. And so I just want to start making that we're talking about something that's going to be good for the health of the community as well. What I learned through this whole process is that, I had one single piece of this, and this huge team had the other pieces. And if we weren't working together, none of us ever would have gotten this done. I cannot stress just how collaborative this was and how necessary it was to build relationships. What we're trying to do with the program is to give the mobility management trainee the skills, knowledge, and resources in order to research their own community, find out the answers, the specific needs, because it's going to vary from community to community. It's going to vary from individual to individual. And so then we had to start beginning to consider all of these possible variables, what kind of students we were going to have. And we'll get into all that as we go through the presentation. I do want to absolutely, wrong one. I keep clicking the wrong thing. Put that down and I'll stop it. All right, so this is a list of all of the agencies. And this was a list that I received back in 2020. And so if we're helping and your organization is not on here, I do apologize, but it looked like I recognized all the names. I think I got everybody. But this was just, it was a phenomenal team. We also had a lot of people, because we tried to use content that was already existing or modify the content to our uses. And so we had a lot of organizations nationwide who gave us permission to use their content at no charge. So I think that's pretty exciting. But like I said, I had no clue what mobility management was, or even worse, what equitable access to transportation would look like in rural Missouri. But I quickly understood that the group I was working with did know and understand the problem. One of the things that they had already created when I became a part of the team was a problem statement. I am not even sure that we had to do any wordsmithing to this. So I'm going to read this to you verbatim because I think it's excellent. Rural Missourians face transportation barriers that limit fullness of life and basic needs such as health, food, education, employment, and social interaction. Because transportation is tangled, complicated, and expensive, though identified as one of the top 2 barriers in communities across Missouri, it is not addressed. And so they had a problem statement. They knew where they wanted to end up. It was just, how are we going to get there, that they hadn't articulated yet. And so that's kind of where I came in. And I remember in one of those first meetings, and originally I had not credited this to the person I remember saying something similar, but since she's here, Mary Gordon in one of the first meetings said, I see this network of local community-based mobility managers that could coordinate rides across Missouri, not just for healthcare, but for grocery shopping, employment, even social interaction. That's equitable access. And I want our mobility management trainees, as a final product of taking the course, to have created their own national, state, and local mobility management toolkit. And I said, okay, and what do you see that including? And I loved the response because it was, I don't know yet. It was the most enthusiastic I don't know I think I've ever heard, but I don't know yet. But what they did know was this, that when you start looking at things like equality, their reality was not even at this level. This was more the reality. And that when they looked at this, next slide, which is equality versus equity, this did not go far enough for them because there was still a barrier there. What they were looking for and what we have tried to design is this. And that is liberation. We're going to remove the fence. We're not going to let you do anything. We're going to let you choose whether you want to go to this baseball game or not. And we're going to figure out a way to get you there. And that's going to be without bias. That's going to be without anybody saying you're taking advantage of the system, because we need all of our communities to be active and seen, and even more importantly, heard. And that was what they were trying to create. Beyond being able to get somebody a ride, they were trying to create a world where it wasn't such a big deal, where you didn't have to be isolated. And all of us know what isolation has done to us over the last 2 years, really. And so that is where they were heading. All right. But they also had to face the reality of this. And this is from the Citizens Guide to Transportation Funding. It actually is a wonderful PDF. I had no idea And it's written in common language. So even though I didn't speak transportation yet, I understood what they were saying. So seventh largest system, what does that mean? We have roads, we have highways, we have bridges, and all of that infrastructure. I'm not sure if I'm using the correct word there, but all of that is the seventh largest system in the US. In fact, our highway systems, roads, all of that is larger than Kansas and Illinois combined. And then we are the 45th in how much revenue we expect for our transportation. So there's a lot to overcome besides stigma and bias. Politically or policy-wise, we have a lot of work to do to really make the system equitable. But they knew where they wanted to start with that one simple thing. Let's get somebody in there who knows the local community, who knows the local roads, who knows what's there, what the resources are, gaps, barriers, all of those things. And that was what we're moving toward. So first thing we had to understand as a group was, what do people need, want, or where do they want to go? And of course, healthcare appointments are always the one that we look at. And they just kept saying, no, not healthcare, or not just healthcare. And at first, I really didn't understand that until we really started looking at rural social determinants of health. And the thing on this graphic that I've used here is that transportation is actually listed out. It's just not included in another category. If you're in a large urban area that has some sort of a public transit system, you have access to transportation most of the time. However, that is also going to vary in urban areas. We decided to focus on rural because when you look at community health needs assessment, and in my other roles, I have looked at several, and every single one has transportation. But when you look at their plan for the future, no. So there is actually data out there to back up what the problem statement says and all of that. But as I said, they were more interested in getting the person to wherever they wanted to go and then back home. So some of the problems that we were looking at, we all know that the cost of healthcare are driven up by missed appointments and last minute cancellations. But here's the problem. If you have Medicaid and you are relying on Medicaid transport to get you to your appointment and back home again, and while you're at your appointment, they prescribe you a new medication and you need to get to the pharmacy, Medicaid transport will not do that for you. And so the vision actually is on that. Maybe we can get someone in the pharmacies to commit to either delivering the medication to the person in wherever they are in the hospital or wherever they are with the clinic, or to provide transportation to and from the pharmacy so that the person would still have the ability to talk to the pharmacist if they wanted to, face-to-face and privately. There's a lack of access to specialists in rural areas. And any of you that already live in a rural area, you know this, but it was something we needed to make sure that we had written down and considered and that our curriculum addressed. I used to live in Poplar Bluff, Missouri, down near the Boot Hill. And about 30 minutes away is a place called Culin. And I was doing community support work with mentally ill individuals. And so what I knew about Culin is there was a Dollar General that was built while I was doing the job. So they didn't even have that prior to then. A Dollar General, a Quickie Mart, and a bank. And that was it. And if they could not get from Culin to Poplar Bluff, which was the nearest shopping, that was the food. And so all of us have been in Dollar General probably, or a store similar, or a Quickie Mart, and it's filled with processed foods, fast foods, and there's no access. It's a food desert is what it is. They lack the access to fresh fruits, fresh vegetables, unprocessed foods. Stop eating that one. Okay, but then what do the consumers look like? And of course, as I said, my thoughts were still embedded in that whole Medicaid transport kind of thinking. And I hadn't really broadened my expectations. But then I realized that research is showing that it's better for older people to stay in their community and even in their home, that they have better outcomes, especially related to dementia. And once you lose the ability to drive, there is nowhere that you could go in a rural
Sherry,
area. Mary cut out on me, guys. Can you all hear me?
Yeah, I hear you. Mary froze up.
Hold on, Sherry. I'm trying to pull you back up.
Okay, can everybody else still see the presentation?
Yeah.
Yes.
Okay, I'm going to keep going. All right, so who needs access? A lot of these, I'm sure that I don't even need to go over them, but the other thing I want to bring up is this. If you are on Medicaid and you have an urgent medical need, maybe you broke your arm, don't have any way to get to, probably don't even have an urgent care, but no way to get to the ER, and you can't use your Medicaid transport because you have to schedule that 5 days in advance. So your only option in a rural area is to call an ambulance. Well, that drives up costs too. And so we try to consider those kinds of things. How can you think outside the box to release the stigma from people who lack access to transportation? Because it's just not only the poor. And they don't just need access to healthcare or access to groceries. They need to be able to get to their jobs. So we're really hoping that another group that we can attract are big employers, so that we can maybe figure out how to get people that are embedded in those big employers. Like in Poplar Bluff, it was always Briggs and Stratton. And I know for a fact that if you didn't have access to transportation, there was no way you could walk there. Even if you lived close to Briggs and Stratton factory, it was still a huge distance with no sidewalks, none of that. So it is a big deal. And then we thought about the people for whom English is their second language. And you might wonder, why did we include that? Well, I know that if you immigrate from the US to Japan and you want to drive there, because they drive on the opposite side of the road, you have to take, I think it's at least a year-long defensive driving course, because you have to completely retrain your brain and how it triggers your body responses. So, all right, but now what is mobility management? And so we have coordinated, collaborative advocacy for the unheard and unseen, and then liberated access to transportation. Those are the things that we're going for. But what do I mean by coordinated? Coordinated, one mobility manager takes advantage of all of the possible systems available to them, all of the resources to get the person. So they may use multiple different services. Some of them may have a small fee. Some of them may be bus routes, whatever it takes to get the person locally where they need to go. And then we have collaborative, because once we have the ability to have more than just one mobility manager in the state, we can collaborate with other mobility managers and move people Southeast Missouri all the way to Northwest, whatever we need to do to get people's needs met. So I do want to provide you with a sample definition of mobility management. But I want to stress the fact that there is no one definition. And I have not been allowing questions. I apologize. Let me read this definition, and then if you do have any, we'll stop for a second. Mobility management is a customer-centered approach to finding transportation solutions for all populations, with a particular focus on people with disabilities, aging populations, English language learners, low-income communities, and other groups with unique needs. All right, do you have any questions over what we've gone over so far? Okay, so that is a skill I learned from this group, is how to wait for answers. Because when you're looking at a screen full of dots or black squares like today, it can be very, very intimidating. And so I learned how to be patient for answers. And it has a skill that I'm glad I did this. So I have learned just as much as everybody has learned from me. At least I hope they have. All right. So I'm going to go, I'm not going to read through these. These are the course objectives. Students are going to be able to identify barriers and resources. But the most important thing I want you all to notice down there at the bottom, by the end of the course, these students will have a national, state, and local mobility management resources toolkit. And I'm telling you, I just love it. They didn't know yet, but they know now. So it all worked out. So what we had to do, though, is recognizing that every single individual is unique, and then every single community is unique, and on and on out. So if we're going to have a local mobility manager, they have to know the boundaries of their regions. I mean, for me, when I was doing the community support type work, it was probably about 100, no, not 100 miles, but about a 30-mile radius around Poplar Bluff and in Poplar Bluff, of course, but got off track. They are going to have the national states, but we knew that we could not teach them about the local environment, the local community. They were going to have to do that research themselves. The only thing we could do was teach them how to find their own answers. And then they're going to turn those answers into us. We're going to provide feedback to them to improve their ability to search even deeper and to keep that process going. We'll go into detail more on how we did that in the following slides. We provided knowledge of and access to other national and state mobility and transportation resources. And there are a lot of them. I had no idea. When they said a complicated issue, I had no idea what that meant. It's insane, you guys. I guess you probably know that, though. So we used websites and blogs, online webinars, an e-learning course, and then we also provided knowledge of and access to current programs and information. So we tried to get some rules and regulations in there. I'll tell you about the future plans in a minute. Well, let's concentrate on the certificate program for right this minute. I get excited and I want to tell you everything at once. All right, any questions here?
Sherry, I have a question.
Yes.
So this is just about a population if they qualify for transportation assistance. I've known people that have maybe made some poor decisions and they end up without a driver's license. And for example, if they're on probation and they have to, I was pretty shocked at how many meetings all over town that people that are on parole have to attend, whether it's at the court or their parole officer, where you don't have a license to drive. And, even in Columbia, it's hard to navigate the public transportation system. And if this population of people are late or miss one meeting, they have they could immediately be sent back to jail. And so I was just wondering, and a lot of people in that category don't have the support systems, and the appointments are during the day. So if they go back to work, they would have to have an employer that allowed them to leave work, sometimes multiple times during the week. And then if they don't have, the transportation or have to take public transportation and they have to get, that just takes so much time. So they miss more work. I mean, it's just the cycle. And I was just wondering if people in that category qualify.
So Kathleen, is it okay if I answer this, Sherry?
Please.
Okay. So Kathleen, what you're talking about is really what a mobility manager needs to know in their community, because each one is going to be very different. And there may be resources there that people don't even know about and how to connect that person to the right resource. So there is no answer to that, because what we have found is there is actually a lot of pockets of money out there. They're not coordinated. People don't use them. And it takes somebody who is focused, such as a mobility manager, and that is what their focus is, not doing another part of their job. And I think that is what, as mobility managers, we see as the largest problem, is that nobody is talking to all the silos and trying to connect the dots. So mobility management for me is a training on connecting dots and having conversations and listening. So yeah, there's no one answer for that. But yes, I used to work with that population, and it is extremely difficult. And it's definitely one that we need to start having bigger conversations about, and how that can be helped.
Thank you, Mary.
Mm-hmm.
And I think one of the goals of the curriculum as well is to remove those the stigma from those things. One of my clients, when I did the community support, was quite mentally ill. I don't remember his diagnosis, but he had was self-medicating, got drunk, caused a scene, and then ended up in jail and then on parole. But he really lacked, and they made him pay for it was a private parole that he was assigned to, and they had him paying for it, which he didn't have the resources for that either. So what I see the mobility manager doing is being able to advocate for all of those, whatever their needs are, whatever the socioeconomic status and all of that.
Right, and be a member at the table for the discussions.
Yes.
To help brainstorm
without us.
Solutions. Yes.
Let's move on. We're going to run out of time if I tell you all my stories. Okay, so the overview of the certificate modules, we started it with the basics. We had to make sure they understood kind of an overview, the sample definition that I gave you, but also that they understood the language of mobility management and transportation, and that they had access to resources like that. So the toolkit assignment that is a windshield survey. And what on earth is that? Well, it's actually something that I have discovered that's used quite often in nursing education, and then we have used it some in the School of Medicine as well. Essentially, the student will map I can't even think of what I'm trying to say. Map a course. That's the best word I can come up with right now, through their town, and making sure that they hit areas they don't normally drive through, or acknowledging how large of an area they're trying to serve. But to try and hit all of that. And when we go into the demonstration of the Canvas course, I will show you that and the guide that we've given them, what we expect them to do. So we'll talk a little bit more about that one then. And the idea is not only for the student to notice what is present, but to notice what's not there. So we'll get more into that. Okay, so module 2, we want them to focus on their community. But we have the windshield survey, which is experiential learning. So they're not just sitting in front of a computer all the time. We've provided PDFs, we've provided transcripts for the videos. So somebody with a Kindle they're going to the doctor and they want to read one of the articles while they're sitting there, download it to their Kindle or whatever, and just read where they are. So it's designed for that kind of learning, which is asynchronous. That's what that is. It means that our students will enter the course one at a time, or there's not one start date where they're going to register in this month and then they start middle of the next month. They will start the course once they're registered and once they're ready to begin.
Hey, Sherry.
Yes.
This is Mary. I just want you to know it's 9:52, and I think this ends at 10:15. So I'm just giving you a heads up on time.
Okay. So let's just look at this from this way. In module 2, they're going to be using a community health needs assessment. We have them identifying for the local one so that they know where to find the new one every 3 years, and those kinds of things. The mobility ecosystem, what is the transportation that's available where you are? All of it. A lot of good resources out there for transportation inventories that are already created. And then we move into community collaboration, because just like this curriculum did not come together with one person, neither will a successful mobility management plan, if you will. The mobility champion is about advocacy. And I chose that word. In the VA, they call someone a champion if they have chosen to advocate for a particular issue. So if you were looking at homelessness in the veteran population, and that was, you chose to be that person, that advocate, you are the veterans homelessness champion. And so I thought that was good. Elevator pitch, you create a speech, if you will, but it's a pitch, not a long term. However long you're going to be in an elevator with a person, 30 seconds to a minute kind of a thing. So we are getting them out into the community. All right, I'm going to stop harping on that. Let's move on to the next one. Okay, so I'm not going to go as in depth in this. I do want you to know that we're not charging for the course. And nothing at all that is provided by the grant from ICAM. I'll go over a lot of these points as we look. Okay, so let's go ahead and look at the course itself.
I just want to mention while she's pulling that up, we are really pleased at how people-friendly this training is, and how people can take their time to create this and go through it. Some of them may be very well versed in some chapters, and they can zip through and spend more time on others. And so anyway, I'll turn it back to Sherry. She's back.
Thank you. So this is so this purple bar, purple there won't be. You're looking at the course from my view, which I'm listed as an instructor. So, but this is how the student will come in whenever they log in. This is the first place they come to. So if they have questions about it, they know exactly who to get a hold of. Because in this context, these are people become students, they will never look at the syllabus. But y'all are, because we did a lot of work on it. This is where we did a lot of the work of making these considerations. We had to make sure the toolkit assignments and the modules flowed. So we considered that. We wanted it to be attractive. And so Canvas has a feature that we could pull these colors and then use them. And that's what we did. Really tried to make this look professional and slick. And when we get to the future plans, we're really planning to look at it, turn that up a notch. So this is not all of the modules. There is a welcome module, but I have that one not published yet. All right, so the way we have this organized, you start a module, you have to complete the module before it's all locked for the next one. So you have to do it in order. We did not make the same stipulation through for this. They can do these pages in any order. I hope they choose to begin here, because at least then I know this is also in the syllabus. So at least I know they marked that. And then I'm always worried. I couldn't figure out what I was supposed to do when I was going through it as a student. So I added the note there. You have to mark it as done. And then click here, go back to the modules. You notice now there's a check mark here. Now this next one is an optional podcast. And it's optional, so they don't have to do it. And so then when you look at that page, there's no need to mark it as done. So we considered all of those things, tried to make everything as far as the wording and everything look good. I cannot refer you all to the NCMM e-learning and trainings and things like that enough. It's a very, very slick site. We'll see how it works going back and forth from the Canvas course to that. A little worried, but anyway. Also I let the students know exactly which of the resources will be on the quiz. We use quizzes not to measure learning. We assume that these are adult learners who are choosing to be the champion for this issue. And so with that in mind, we quizzes, if they are graded, it's just so that we can provide immediate feedback to the learner, whether or not they're getting the gist of the material. All right. Like I said, the NTMM has a lot of e-learning videos that we are using. We're also using specific to Missouri information. This one, while it has, it's a national article, it does talk about HealthTran. And I cannot say enough about HealthTran. It's amazing. Go out there, learn about them. They're doing fantastic work. Mo Rides is another one that I just, can't compliment enough. All right, so this is what a quiz looks like. And notice I have a link to every single resource. Now, the ones on the video do not link to the videos, they link to the transcripts. So click into that. I don't know if you noticed at the top on that last one, but it's up there that you have 15 attempts, there's no time limit, and you only have to get 4 or 5 right. You can keep these open throughout the quiz, or you can not open them and see how you do. And that's what we're going to do. So Mary and Sandy can't answer. I think I see some other folks who might know these answers too. But number 1, mobility management is and somebody open your microphone and give me the answer, blank approach to creating and implementing transportation solutions that respond to mobility needs. Is that transportation focused, provider focused, destination focused, or customer focused?
D.
B?
D.
D.
Customer focused.
All right. Confuse me. There are only dots, there aren't letters. Okay. All right, so true or false? Now, keep in mind, what I did was copy a line from resources that they're going to have access to. So I gave this quiz to my husband last night because I was practicing. And so don't get confused by these adjectives. I don't think anybody should be a tireless worker ever. I think home life, life balance is important, but a mobility management professional should be a tireless advocate for those who need transportation and a cheerleader for potential solutions. Is that true or false?
True.
True. What is the Missouri fuel tax in cents per gallon?
Well, it's 17 cents now, but didn't they just pass a law? It's going to go into effect August 28th. That's going to increase that tax.
I'm going to have to change my question.
I'm pretty sure because then if you save all your receipts, you get your refund. I'm pretty sure they changed it, Jerry.
And this is another thing that we faced. We found out real quick that for spend down for Medicaid, if we used actual numbers for the standard deductions, we would be out of date within 12 months. And we really don't want to have to update things. We'd rather just do it 4 times a year, do it quarterly, as opposed to having to make sure we get it done, think about every single little thing. So we're trying to avoid that and just give them the link to the current information and go that way. All right, so how many Amtrak routes are there in Missouri?
Oh,
I'm going to say 4 or 7.
Give me which one?
If I had to pick, I'm going to say 4.
All right. This one, I don't know if you guys are going to be able to read them fast enough, but what is the definition of door-to-door service? And again, these were directly copied from the content, so you may recognize it quickly. All right. A, B, C, or D? Just somebody shout it out and we'll go with that. Oh, you're a bunch of chickens.
Jerry, I can't help you. I can't read the words.
Oh, I didn't even think of that, you
They're
guys.
too little.
Oh. All right. Submit the quiz. All right. So we got 5 out of 5. Hey, y'all are brilliant. We'll send you a certificate.
Yay for me.
Okay. So they can take it, like I said, as many times. If they got 4 out of 5 and could pass, but they're like me, you got to win all the points, then yeah, you can go back. And actually, I discovered that it will take your highest score because I was getting angry. I couldn't figure out how many. I couldn't remember how many Amtrak. I guessed every single one before I finally got it right. I just thought there were more than that. But all right, so this one, I caution them not to start the assignment yet because they're going to do the windshield survey out in the community. How much time do I have left? Okay. All right, let me show you the guide really quick. We have them do all the safety precautions, but essentially what we're going to have them do is notice the weather because that is going to make a difference in how they view the community. You're going to look at the community life. Who do you see? Who do you not see? All of these different things: housing, open spaces, shopping, religion, services, transportation. We tried to think of all of them. And then anything else, we just added that in there. Anything else you notice that you think might be important to your people. And then because now eventually this is a dummied up version of QLin, because I knew it. And essentially what I did was I went through and fictitious person, of course, but I took Google Maps and mapped out with my purple highlighter here the route I was going to take. And then I just simply wrote down, I did a walkthrough of that route on Google Maps. And that's how I wrote all of this. And then, of course, I also looked at the CHNA. All right. So what they do then, when they start the assignment, is they're going to go down here and they're just going to write it. They can write it before they even do this and just copy and paste, or they can write it right here. Doesn't matter. Once you submit the assignment, I'll do that. Once you submit the assignment, regardless of how thorough it was or whatever, you can now move to module 2. If we had tried to do that before we marked all of those as done, it would have just simply said that we didn't have access yet and tell us what we still needed to do. And I am going to stop the demonstration there. We do have 8 modules plus the welcome module. And share my screen again really quick. And I am just going to, okay, questions over the demonstration while I'm getting this back up.
So Sherry, is the plan for mostly community health workers to take this course, or who's the intended audience in the community?
Yes, community health workers are definitely, and we did have someone from that board on our team.
So Kathleen.
So thank you, Mary. All of a sudden,
You're welcome. You're welcome. So Kathleen, we of course, a high priority is community health workers. We've also been kind of in dialogue with Angela on this and how maybe we could link those trainings so back and forth, because they share a lot of the same customers that have the higher needs. But this is something that actually anyone in the community, we also kind of designed this as something that could take somebody in a job and move them up to a higher paying position, or somebody who doesn't really have any higher education, but there is a need and maybe they're working for a transit agency and want to take this and kind of move more for mobility management within there. It could be someone within a city hall or a city council. It could be someone in a hospital. We're hoping medical providers besides community health workers, maybe in other medical fields, or in somebody in the community, or highly recommend community action agencies. We have 3 working with us right now, and all 3 of them are amazing, and they are very focused on the populations of highest needs. So this is who is the champion, or who could be the champion in your community, and getting this out to somebody. We kind of estimate someone can do this as quickly as 4 weeks if they're dedicated. But then we give them up to 6 months time if they've got busy lives. So it doesn't, they can do this on the side, or they can do it, trying to move into a new job. Doesn't matter. I think what Sherry's demonstration showed some, but not as much, as this thing. You just go click and you go here, and you can either read it, or you can watch the video, or you can click and you can watch something else, and go click over here, and you're at a resource where you can explore that whole website, because we don't know this mobility manager training. Maybe I'm coming in because I work at assisted senior living thing, and I'm really focused on seniors. Maybe I work with disabled and, an SB 40 board person, and I'm more interested in the disabled section. Maybe I'm more interested in children getting to school. So as they develop their toolkit, they are developing the toolkit that works for them. And I think that's what we really wanted. We wanted them to walk away and walk out and be able to implement what they've learned. And then they've got a lot more learning to do, but it gave them a great jump start.
Thank you.
So I'm not going to beat the plan I'm not going to go every word of this one, but I do want to make the point, and ties into what Mary just said too. So our test cohort actually worked with us. I think everybody that's in the test cohort had worked with us from the beginning. And then at a certain point, when we really started getting into like the quizzes and the content and that kind of thing, we did have them stop, but they're very familiar with the content. And so we do think that they'll be able to get through it pretty quick, and that we'll be able to get them feedback and their evaluations of everything. We're going to do extensive evaluating with them. We're going to ask them to evaluate every single resource, everything. Whereas our regular students, we're only going to evaluate at the end of the course, and then by module. But all of that feedback, the point is, it's continuous improvement, and that is what we're dedicated to. All right, so last slide, I promise. Future plans. We have the grant from ICAM. It ends December 31st of this year, but then they have, I think of us as we now, but anyway, we have a grant to continue that. And Mary, I did not write that down. Can you tell them who has the name?
It's an additional FTA grant, Federal Transit Administration, and it's called the CCAM grant. It's the Community, I get this confused every time, Coordinating Council on Access and Mobility. And so we are utilizing that grant to do two things at MRHA. One is to continue working on this and begin looking at certification programs across the United States, and how we can all kind of develop a national certification with a lot of the same stuff. So we're going to have a lot of discussions with that. Wisconsin really has been leading mobility management certification for a while. And then the other part of that is helping MRHA become the technical assistance site for mobility management. And as you probably noticed, the instructor in that is me. Eventually we'll have someone who's very focused on that and takes kind of that over. But we really are excited about getting this training out and making it, because it's the only thing that we've seen that is really making changes.